Hi, I'm Elisa with justorthopedic.com, and I'm sitting here on location at Pine Creek Medical Center in Dallas, located north of UT Southwestern. And I have the pleasure of being here with Dr. Nilpesh Patel with Lakewood Orthopedic and Sports Medicine. Are you doing okay?
I am. I'm doing well.
Doing good. Very good. Well, we had a viewer actually very specifically write into us inquiring about lacerations. Do you see a lot of patients come in with a cut or a laceration? And if so, tell us about how or some of your experiences with that.
So lacerations or cuts to the hand and fingers is very common. I probably see a couple every clinic I have. As you can imagine, we use our hands for everything and get them into any activity, whether it's using a knife or playing sports or playing with your kids. So it's very common to have cuts in the hands. There are simple lacerations. So simple lacerations usually just involve the skin. Okay, and when a laceration involves just the skin, one of the main things I'm trying to figure out is, number one, is this a laceration that needs to be repaired? Is it a type of laceration that can heal on its own? The other question that I'm asking is, does this laceration need something more complicated to close? Is it a big enough laceration, or is it very complicated that it needs a surgery where I may have to move skin around and actually close a certain type of cut? Then there are deeper lacerations or more complicated lacerations, and these lacerations can involve deeper structures into the hands and fingers. One of my main jobs as an orthopedic hand surgeon is to figure out if any laceration involves the deeper tissues. And I do this by both talking to the patient as well as examining the patient. So if they tell me they've gripped around a knife in this way, then I'm thinking, okay, this is the type of injury they could have to the hand. And by examining the patient, you can see if they have cut deeper structures. So we get people to move specific fingers in specific ways to see if those tendons are still working. We use very specialized tests to figure out if sensation is intact, whether it be sharp sensation or cold or heat sensation. And by that, we can figure out if the nerves have been cut. We can do other tests to figure out if blood vessels have been injured as well. And then we have x-rays to see if the lacerations went deep enough and affected the bones. Sometimes lacerations go so deep that they can go in also into the joint. And we can examine patients to see if they have joint instability because of a laceration. Once we've determined this, then we make a decision whether that can be treated in the office or it needs something more extensive like a surgery. So many tendon lacerations to the hands do need to have surgery, and tendon lacerations are very complicated. They involve extensive surgery and extensive rehab afterwards. And so it is very important to really look at each laceration individually. It is really important to have all your little cuts evaluated, especially in the hand. And if you do note that you are not able to move a particular finger in a particular way, or you have lost feeling, then you should definitely and more quickly have your finger or hand evaluated for a laceration.
Wow, it sounds like people are in a lot of pain when they come see you with these lacerations. So you're their hero too, all at the same time.
Well, yeah. I mean, many lacerations do hurt quite a bit, but I think especially when you have tendon lacerations and you can get function back to someone's hand, it does make you feel that you did do something for this patient and give them a function back that would have been hard if they lost. So
that is fantastic. Thank you so much. Dr. Nilpesh Patel with Lakewood Orthopedics and Sports Medicine. I'm Elisa with justorthopedic.com. Follow us on Facebook, LinkedIn, and Twitter.